Is COPD and sleep apnea the same? If you're wondering whether COPD and sleep apnea are the same condition, you're not alone. These two health issues can seem similar because they both affect breathing, but they are distinct and have different causes and symptoms. Let's start with COPD, or chronic obstructive pulmonary disease. COPD is a group of lung conditions that make it hard to breathe by blocking airflow in the lungs. It includes conditions like emphysema and chronic bronchitis. Emphysema damages the small air sacs in the lungs, making it hard for oxygen to get into the bloodstream, while chronic bronchitis is an inflammation of the airways that brings up a lot of mucus. The main symptoms of COPD include shortness of breath, a persistent cough with phlegm, frequent chest infections, and wheezing. These symptoms usually get worse over time and can be triggered by physical activity. On the other hand, sleep apnea is a sleep disorder where a person's breathing stops and starts repeatedly during sleep. This can happen because the muscles in the back of the throat relax too much, narrowing or closing the airway. People with sleep apnea often snore loudly, gasp for air during sleep, and feel very tired during the day. Sleep apnea can be diagnosed through sleep studies and treated with devices like a continuous positive airway pressure (CPAP) machine. One key difference between COPD and sleep apnea is when the symptoms occur. COPD symptoms are more noticeable during the day and worsen with physical activity, while sleep apnea symptoms happen during sleep and can disrupt a person's restfulness and overall health. Although they are different conditions, they can coexist in what is called the overlap syndrome. This happens when someone has both COPD and sleep apnea, which can lead to more severe breathing difficulties, lower oxygen levels in the blood, and higher levels of carbon dioxide. This overlap can make managing both conditions more challenging but is not uncommon, affecting about 10 to 15% of people with COPD. Both conditions share some similarities, such as causing fatigue and daytime sleepiness, and they are both linked to cigarette smoking, which can trigger lung inflammation. However, their causes and primary symptoms are distinct. COPD is mainly caused by long-term exposure to irritants like cigarette smoke, air pollution, and dust, while sleep apnea is more about the physical obstruction of the airway during sleep. In summary, COPD and sleep apnea are not the same condition, although they can occur together and complicate each other's symptoms. Understanding the differences and similarities between these two conditions is crucial for proper diagnosis and treatment.